Hi, everyone. I'm Katie Ullman, Senior Media Specialist for Hassenfeld Children's Hospital. I'm joined today by two really amazing mental health experts, Dr. Ron Lee Liaw, Chief of Service for Child and Adolescent Psychology at Hassenfeld Children's Hospital, and Director of Sala Institute Child Family Services and Resilience Programs, and Dr. Rebecca Berry, Child and Adolescent Psychologist at the Child Study Center within Hassenfeld Children's Hospital. She specializes in caring for kids with anxiety, OCD, eating disorders, and many other conditions. So, welcome, Dr. Liaw and Dr. Berry.
Hi, Katie. Thanks for having us.
Great to be here.
So, tonight we're going to be discussing a topic that I'm sure every parent can relate to: how COVID-19 has affected our kids' mental health, and ways we can help them build resilience and prepare for new routines as the pandemic is yet again changing our regular rhythms. So, Dr. Liaw and Dr. Berry are both child and adolescent mental health experts, and they've been on the front lines of caring for children who needed extra emotional support and mental health treatment over the past year. So, this time last year, we were talking about things kids had lost: graduation, summer camp, visits to friends, and grandparents. So now we're looking at the world opening up again. What challenges is that presenting to kids? Dr. Berry, I'll start with you.
Well, I think that for kids and parents and many of us, even the idea of reentry can be fatiguing, right? We've been used to a certain way of life, virtual, nearly everything, and now we're really like facing the world being as it used to be, right? Things more in person. And so I think some of the challenges that we can expect for our young people and parents, I'm going to include everybody in this picture, right, is an adjustment of our sort of energy levels, an adjustment of some of the emotions that may come as a result of being asked to do new things. And I think that what used to be relatively, sort of routine, mundane, or easy for us before the pandemic, now that we're getting into the reentry phase, those type of routines might actually be more taxing for us. And with that comes more of an energy expenditure. So we may see our young people be a bit more tired at even typical things like conversations. We may see them have an increased need for sleep. And we may also see that some of their emotional reserves are depleted, which means they may be more sensitive. They may be, for our teens especially, they may be more snappy or irritable, right? And even for us adults too, as we really find our way back into our sort of old life, if we call it that.
And Dr. Liaw, do you have anything to add? I guess from like a hospital setting, how are kids faring right now?
Yeah, so I agree with everything Dr. Berry just mentioned. And actually thinking about it, I was thinking about, our own families sort of re-entering life and routines as we knew them before COVID. And it's scary. All of the little things that we did on no problem, take the train, go to school, go to work, right? Go grocery shopping. All those things became scary at one point, in this past year for all of us. And so I think it's really important not to minimize that, even though we're a year plus out. In the hospital, we're seeing what all children's hospitals are seeing across the country, and all mental health providing clinics and practices. And we're in the middle of a huge mental health crisis for kids that predated COVID, right? We already had a shortage of child mental health professionals like Dr. Berry, myself, social workers and mental health counselors we work with as well. And so in the wake of COVID, with all of the parental, 40,000 kids have lost parents in this epidemic in the last year, right? And the bereavement and the toll of that. Many parents have lost jobs. Many parents are juggling childcare and work if they're lucky to keep their jobs and working remotely, or are dropping their kids off at care centers as well, and juggling that in a very different sort of world, even as things are reopening. So you see that level of stress happening across our society, and particularly falling on the shoulders of parents and kids, and all the adults who care for them, albeit teachers and doctors and nurses. So there's a huge mental health crisis right now. Every children's hospital I talk to has, many of their pediatric beds, emergency rooms are filled with kids who are waiting for care and waiting for everything as basic as a therapist for counseling, to a psychiatrist if they need medication evaluation, or if they need higher levels of care. That might be a psych hospitalization or a partial program. We could talk about all these different services for kids that are really maxed out because kids are so stressed and have been for over a year now. So we're seeing increased rates of eating disorders. It's interestingly in our pediatric hospitals across New York City, across the country, we're seeing increased depression, anxiety, and also suicide and suicidal thoughts, suicide attempts. We take all those things very seriously, and because there is help out there, and I think it's helping families navigate how to get their kids the help they need. So, just a touch of that, but it's everything from the normal things like going to school in person, right? Taking off a mask if you're vaccinated, right? Like going to see your pediatrician for your well visits. All those things are kind of stressful right now for some people, right? This is the first time we're doing it in a long time.
Are there signs that parents can look for in their child to, if they're struggling?
I'll go ahead and answer that. So I think, so just to kind of follow up on what Dr. Liaw was saying about what we're seeing, I think, so I'm working in an outpatient basis primarily. So I see a lot of youth and young adults especially, but we're certainly seeing a lot of anxiety, a lot of depression, and certain things like eating disorders, as she said, and OCD. And so I think some of the signs that parents can look for really in their youth are, any major changes in their child's behavior, in things, and also, so I mean, I know that we've been spending a lot of time alone. So I would have parents look for any of their children spending more time alone than usual, and really a refusal to engage in typical routine activities as the family normally would see them doing so. Is there any change to their sleep patterns? Are they sleeping more or are they sleeping less? Are they eating more or eating less? And is there a significant change in their mood or their affect, the way that they're exhibiting emotions in their face and in their body? We could expect some of those changes to occur naturally, but if we're seeing these affect or emotional changes on a regular basis in a way that feels different, in a way that actually might be getting in the way of the child being able to enjoy things or participate in typical activities, then I would say to the parent, it might be time to kind of consider, seeking some other support services, whether from another, mental health counselor or somebody else.
Are there ways that a parent can encourage their child to open up, or like tricks that you use to get them to express their emotions?
We have lots of tricks, right, Dr. Perry? No, my kids are always like, are you doing one of those psychiatrist things where you're going to make me talk
Right.
about stuff I don't want to
analyzing
share?
Me?
We do have a Jedi mind thing happening. So Katie, we can tell what you're thinking. Just kidding. No, I honestly and I'd love to hear what Dr. Berry, her tips are too, but we really, I think we see kids we see parents when they're pregnant, actually expecting children. We see them through their infant years as they're working through new family sort of growth and development and being a new parent. We see toddlers, we see school age kids, we see tweens and teenagers, and we see a lot of college students and young adults as well, all the way through. We're like lifespan mental health people. And so I think, you have to base your approach and on sort of what developmental stage the child is that you're trying to have a conversation with or engage or learn more about. I think it's always helpful to start with open-ended questions or no questions and actually just listen for their cues. So if it's a younger kid who's into playing Legos, I've played a lot of Harry Potter Legos and Ninjago and all that, and you get into their world, and then you can kind of like soft start and gentle start those things. The moment we start face-to-face asking questions like we would with an adult, kids tend to shut down unless they're like little adults who want to have a conversation. But a lot of teenagers, I like to have side-by-side conversation. We'll walk around and talk and not sit face-to-face sometimes. Actually, it's interesting with the telemedicine because they're all in their rooms actually doing sessions with us in our offices or remotely. And so they're more comfortable. And I think it's easier for them to open up, especially if you have a relationship already and you can kind of build on that. But yeah, Dr. Berry, what are your tips?
No, I agree with that. I think that it's important to, like you said, get into their world, join the activity that they're doing, and really first express interest in that, right? Kind of Not ask too many questions though, because I think that even asking questions about the game or the toy itself can be off-putting for a lot of our kids, but just really following their lead, giving them a lot of praise. And then if they're ready, then offering an invitation, extending an invitation or a time to talk if they're ready. But again, we have to make sure that these questions aren't forced upon them. It has to be something that they're willing and able to kind of take in from us. I often like to just kind of be very active. If a kid likes to play basketball, I'm often kind of like getting into the game first, and then asking them just, hey, just talk to me about what's in your world right now. Talk to me about some of the things that are on your mind. I try not to force too many questions, but rather just kind of like a tell me your story sort of approach, gently. But and sometimes if they reject it, I'll say, cool, let's move on to something else. I accept it, and then I'll keep trying again. But sometimes I do just encourage parents to start by just spending time and focusing on the relationship first. And like Ronlee said, listening, really kind of paying attention to what they're saying, because kids will often tell us when they're not feeling okay. We just have to create the space to really receive it from them.
Yeah, and you started by opening about routines and rituals and things. And this is when, like in a family, the routines are really important. And I think even if you don't have a regular routine where all the family is together, you have one-on-one time with your child, I think it's important actually to start building those in, even within your home, like the safe space of your home, whether it's a meal, sometimes it's a dinner time routine, sometimes it's a weekend, something that you do together, bedtime routine, just to check in, because those times, I think, when they can expect that we're going to be together, we're going to have our devices and screens off and away, right? That you're going to have my full attention, right? And that if there's something that you want to talk about or bring up, or I can even see that something's bothering you because we're in the same space together. Families these days, you're like running a mile a minute. Sometimes we're just not even in the same place, even though we should be under quarantine. We really were on the same place. But even then, everybody was in their own corners on their, school laptops or work computers and things like that. So just that FaceTime and that informal, laid back, open space, I think, is what Rebecca and I would really sort of, if you can create that space, then you'll be golden as they get older too.
So you were mentioning screen time, I guess, between online school and social media and gaming. Kids have been using screens more than ever. Is it time to set limits, and how do you know if your child needs those boundaries?
Well, I think my approach to this is to really consider how screens are being used, how I think they're going to continue to be a part of our lives in a significant way, I think, moving forward, even in reentry. So each child or youth situation is going to be very different, and each family has, I think, their own rules around screen usage. I always like to ask parents to consider ways in which the screen time is contributing to any type of disruption or sort of too much emotionality within the family system or for the child itself. If the kiddo's having a difficult time transitioning to what I call a less ideal or less preferred activity from the screen, and that's happening consistently, and it's getting in the way of going to bed or falling asleep, then it may be time to really consider pulling back, and I think starting or establishing a routine and boundaries around screen time and cutting that off, I think, a little bit earlier before we're expected to go back to kind of things full time in September or whenever that may be.
Yeah, I couldn't agree more. And I think that's where, there's the no screens are created equal, like all screens are not created equal. There's the quality of what your child is doing on the screen, right? Whether it's like a personal device, an iPad or school laptop, right? The same thing. They could be doing schoolwork. They could be chatting with friends. They could be connecting with people. They could be on some sort of educational platform, right? Those are all great, right? Like my youngest loved the electronic books. Who knew, right? And would just go through book after book. I was like, you could do that for hours. That's okay with me. But if it's a TV show or a game or something like that, I really do try to advise. And then it was hard this year. It was just hard, right? Because everything was on the screen for a while. And I absolutely agree. I think it is time to rethink everything. We can restart, I think, as families and as parents. It's okay. Maybe it was like 8 hours and you're like, I need to do something. Let's take a pause and let's think about what intentionally, what do we want those sort of limits to be? How old is my child? What does my child need in terms of physical activity and sleep and healthy in-person interaction, outdoor time? It's really important that we sort of are very thoughtful about sort of how do we reset things as well.
Right. I think for that reset, it's going to be an adjustment, just as it was an adjustment for all of us to get used to this fully integrated screens all day sort of world. Moving out of that might have a similar effect on our minds and our bodies as well. So I think a slow integration of the balance of activities that Dr. Liaw was saying with regard to more movement, more physical activities, and really, again, making that a part of the routine. And I think if parents really model the import of body movement, getting outside, and everything is kind of done together so that parents have to put down the phones too, right? That really sets a precedent for the kids, and hopefully they'll follow suit if it becomes a regular thing.
Yeah, yeah. The American Academy of Pediatrics has a great website. I just tagged it actually before this, healthychildren.org, and they have guidelines on screen. Before it was 1 hour of screen for kids that are over 2. We pretty much threw that out the window, and most screen experts, media and brain development neuroscience experts were like, oh dear, my kids are on like hours, right? But they have a nice guide for like family media planning, like create a plan, and you put in, how old your child is and anything else, and then certain things, certain guidelines, and it'll walk you through how do you add in more of the healthy things for your mind and your body. How do you think about the quality of the screen, and some guidelines for setting different kinds of expectations.
So we have a question that just came in. Why or when I try to restrict my kids' screen time, they act out and shut down. It's always a fight. How can I reduce this without a fight?
Well, I would love to know a little bit more first around what might be leading up to that situation. And second, what type of activity or media is the child engaged in? Sometimes youth get really invested in games that have different levels where they're earning points, and when they're playing with friends too, and it's some type of competition. And oftentimes when parents set limits on that, it can lead to just more of a disruption because it feels that the child has invested a lot in that, and that it's being taken from them. So I'd certainly want to do some collaborative and active or proactive problem solving with the child, actually, to really think about ways that they can reduce or work together with the parent to reduce that type of interaction at the time the screen's taken away. For example, can the child let the parents know that in this screen time window, I'm going to want to play my, enter this game, and that, please give me just a 5-minute warning so that I can know that it's time to end it with my friends. Or maybe the parents can help the kiddo problem solve that maybe before bed is not the best time to do this particular game because it's harder to turn away or there's more invested in it. So I like to kind of get on the front end of things, do some active listening and problem solving with the kiddo to be a partner in that process to see how they can reduce that reaction.
Yeah, I agree. And it's like, the way that these devices and apps and games and streaming, platforms were created, they're addictive. And from a neurobiological perspective, it's all in that same loop that we see for other addictive sort of activities, and as adults, you can imagine what those are. And people probably use those as their coping mechanisms early. It's also a good time to refresh. But I think, to Rebecca's point, like you have a chance every single time to have a conversation beforehand and set it up for more success. Your child, you can text in like how old your child is, because that's different if it's a 6-year-old versus a 16-year-old, right? And we might strategize differently because a 16-year-old can have a different level conversation with you than a 6-year-old might be able to. But don't underestimate your 6-year-old. Like knowing clear expectations, you can have this iPad time, but it's going to last this long, and this is the timer. And this is if you give it back to without having a massive tantrum or meltdown or chucking something, then we can spend time doing this. And I would use something else that's time, like to do something fun together.
I like that suggestion, and I think it's important for us to remember that when we have a reaction like that to screen time, for many kids, it suggests that they're really lacking in the skills, or what I call lagging in the skills, to handle losing something so amazing, which I would say that many of the kids feel that the screen is just gold. So to think about losing that, to have that reaction means I'm not really possessing the skill to know how to relinquish that effectively. So there could be some nice problem solving that parents do with their kids too around how can we help you be, take down some of that or cope with losing that thing. Sometimes kids need to know when they'll get it next so that they have a promise of not, or getting their access to their fun thing later. I really love Rong Lee's suggestion of having something nice or fun planned afterwards so that the child has something to kind of ease or transition into. Maybe not as fun as a screen, but something also enjoyable where they can also work on coming down from losing their screen time.
It's great advice. I guess I'm gonna pivot a little. So as you were saying, this with for teens and stuff, some of kids have thrived in this remote environment and might be experiencing now some anxiety in the idea of returning to the classroom or in-person socializing. So what's the best way to reacclimate a child who is socially anxious?
Right. So to your point, Katie, we are seeing a lot of youth who maybe trended more toward the socially anxious side really take on to this virtual learning model and really enjoy it because I think there were fewer pressures on a number of areas put on them, particularly socially, right? And so one of the things that I like parents to really do is set expectations around reentry for these kiddos and really talk about early on, as much as possible, what the expectations for returning to school will be. And really start creating some opportunities to get out of the house, to socialize, to look up from devices, to give a little bit of a hello if you're, even asking about people's experience in the pandemic. There is some import to small talk and having conversations, even with people we don't know well, to helping just kind of get us primed for being in person with people again. And of course, if a child is very socially anxious, we might really want to think about a more graduated way or stepwise way that they can have more challenging or more intricate conversations with people, and then focusing on getting them more acclimated to peers in person before the school year starts, right? Getting them used to kind of using their mouth again and eye contact, which is so eye contact outside of a screen, right? How do we do that? So it's kind of like these are muscles that we all used to use a lot more, and especially for our socially anxious kids, they haven't had as many opportunities in person to do it. So we may just have to give them some more of that repetition as much as we can in advance.
Yeah, and celebrate the little, like if they do a virtual, play date with somebody or walk to the school or, things that they would usually like feel anxious doing, celebrate those things. And I think it's because I think even as parents are anxious about things as reentry happens as well. I think Rebecca's talked about role modeling, right? Like there's a lot of things too that sometimes like parents will just do or adults will do. But I think also calling out, like, I felt scared doing that, and having your child be able to watch you face something that you're afraid of. I think that role modeling goes a long way in terms of learning.
Also, just after we've, months being told to stay at home and fear human contact, and now thanks to vaccines and lower case rates, we can start kind of venturing out again. What about children that can't let go of the anxiety of getting sick? Is there anything we can do to ease those anxieties?
Yeah, I think as Dr. Barry is getting her audio back in here, with the anxiety about for kids who are afraid of getting sick. And I think the flip side too is like kids who are curious about getting the vaccine, especially the teenagers who are eligible and the tweens as well. Do you want to start with the fear of illness anxieties?
Sure. So with this type of fear, I think we've seen this shift a bit as we're sort of coming, into this interesting place in reentry and pending with vaccines and whatnot. So I typically like to actually work with parents first to understand their point of view about this, where they're getting their information, what's important for their own family in terms of safety and values around that. There may be some messaging happening from the parents down or other family members down that the kids are picking up on that might be contributing to some of their worries. So typically I like to recommend that the family, where possible, consult a body of evidence. Maybe it's the American Academy of Pediatrics, perhaps it's the CDC, perhaps it's a pediatrician, to really kind of think about what our sort of risk is and what safety measures are sort of being, formally utilized or more normative, and then work with the child around kind of trying to integrate into what they're seeing happen in their world and make sure that we're validating their fears, but we're not overly reassuring those fears, and that we're not accommodating those fears too much in a way that might actually get in that might actually make it hard for them to have a typical routine or get back into normal life. And when I say normal life, I mean sort of the typical activities that other kids their age are doing, perhaps going to school in person, perhaps having some outdoor hangouts or something like that. So it's just it's a tricky balance or a dance between noticing and validating your kids' worries around these things, which may still be somewhat relevant, and also not aiding and accommodating that anxiety and allowing more avoidance to happen so that they're not enjoying parts of their life.
We were talking before this about how, kids and teenagers who had obsessive compulsive disorder with fears about germs and had hand washing routines, at the beginning of the pandemic, they were like, oh my gosh, that's right. It's real, right? Like we do need to wash our hands and we should be afraid of germs, right? Everyone was feeling like that, right? And so part of it was also thinking about, normalizing things as you've sort of seen, we've seen what's happened in New York even, right? About with life reopening, the fears, you can insert any fear in the I'm afraid of this, right? It could be fear of school, fear of friends, fear of being embarrassed, fear of heights, whatever it is. But as Rebecca is saying, to get under that, like tell me more about that, validate some of that fear, but what do we have to look forward to? How can I help support you as you sort of like face those fears and move forward? Because there's so much to look forward to. Just walking around and seeing things in the city reopening and kids playing sports again and being able to see friends again and see grandparents. Like there's so much more that you lose when you're feeling scared and avoiding and isolating and stay in that sort of stuck pattern. So that you're finding that it's a little harder to get them to come out and nudge out of their comfort zone. I think that's a great time to reach out for help. It could be your pediatrician, it could be a school counselor, it could be someone at the NYU Child Study Center or at Hassenfeld Children's. There's lots of places you can turn to.
I guess I want to touch on also, we hear the word resilience a lot. What does that mean for kids, and how can we help them turn these negative experiences into growth moments?
Yeah, usually I have two working definitions I have in my mind. The simplest one is like, what does it mean to be able to bounce back from something really tough, stressful, or big adversity in your life or challenge? What does it mean to like be able to face that and work through that or move through that? But the other one is actually like, how do we harness like all the different types of resources we need to stay well? And that's well for a child, well for parent or family. We have lots of sort of internal resources. What kind of skills or capabilities do I have? I have a lot of external resources. Who are the people I can turn to for help, right? Who supports me when I need help or support? And then existential resources, even for a child, like what can I learn from this challenge or this time? What do I feel grateful for, at the end of this, and even every day as I'm working through this? It's an everyday skill. This is a lifelong skill that it's really important for our kids to learn in the context of a loving family, a parent, or an adult, who really is there for you and can help you navigate these things. And it's a skill they'll have with them as they become adults, right? But Rebecca, what do you think about with resiliency in kids?
And I think I may have missed the first part of that question because of my audio, but is the question can you just repeat the question for me?
Yeah, so we hear resilience a lot, and I guess I just want to know, what does that mean just for kids, and how can we help them turn, the negative experiences that they've, through the past year into growth moments that they can, learn from and use growing up?
Sure. I think to start this dialogue with kids, I think it's important for parents to try to stay away from language that forces kids to look on the bright side of things or to find the silver lining, but rather really reflect on how hard everyone has worked to manage and to cope with a really hard transition, adjustment, etc. So to really recognize points already along the way where kids have done the best that they can in spite of all of the circumstances, and that to really bring around this energy toward what the family has done in a unit and how the family has done, how the family has emphasized working together. I really like the sort of terminology from the growth mindset approach, right? That we can do hard things. We are meant to do that. And from these things, we will grow. And I love that Ron Lee said that we can always ask ourselves, you know, what did I learn? What did I learn from this? What did I learn about myself? How can I handle challenges and get through them together? Right? And how I was an agent of change for my own self. How did I advocate for my own needs and take care of my own needs where possible, and also work together with a lot of others to go through something very hard. I think that those moments of reflection for all of us are key. What did I do? What did I just go through? Wow, right? That was hard. And look what I did to come through it. And who was I with through that as well? It can be pretty neat to kind of think
Yeah, I
back.
don't think any child or teenager or family who's lived through this will ever forget this, right? And the things that they learned, the things that they lost, right? How they came through together.
Right.
Well, on that note, I think this is a great place to wrap up. I just wanted to give you guys, if there's any last words you want to leave with the audience.
I think I want to leave off of that my last note that I'm just very impressed by people and how much strength and resolve that everyone has shown in spite of just, you know, a really challenging time. And I know that, like Ron Lee said at the beginning, we are in a really tough place with regard to mental health. And I hope that everyone is asking for help if they need it, and has or can try to find access to resources where possible.
Yeah, and I just said celebrate the small things, you know, that you can enjoy those small moments, and cut yourself some slack, and you're not alone. I think that every parent feels very alone sometimes in their circumstances, and you're in very good company, and if we're always out here if you need help.
Great. Well, thank you everyone for watching, and thank you, Dr. Liaw and Dr. Berry. We hope we provided some helpful information about ways to help your child manage the stress and mental challenges of this reopening phase of the pandemic. And if your child needs extra help, your pediatrician is a great resource, and we can help you find one at NYULangone.org. And please click the like button on Hassenfeld Children's Hospital's page to learn more about future Facebook Lives. Thank you.
Thanks, Katie.
Thank you. Thank you, Ron Lee.
Thanks, Dr. Berry.